Authorizations of the coronavirus outbreak, with confirmed cases now in the White House itself, and 3 of the nation's top health authorities in isolation tonight because of possible exposure. The president at a Rose Garden news conference late today declaring we have prevailed.
Ah, shit. Well, either way, y'all saw it. All them people sitting 6 feet apart. I'm sorry, but if this thing can fly through the air, 6 feet ain't gonna do shit for you. And all these people just standing around and with these cloth masks, and not to mention all the other masks that aren't going to do anything for you. It's all scripted. It's all a game.
On testing, as he appeared to stand more than a dozen feet from the nearest person. The White House stepping up its own health defenses as the U.S. death toll climbs above 81,000. We have it all covered for you tonight. Jeff Bennett leads us off.
President Trump tonight in the Rose Garden appearing to declare victory over the coronavirus crisis before clarifying his comments.
We have met the moment, and we have prevailed.
You said in your comments earlier, we have met the moment, we have prevailed. To you, sir, is the mission accomplished?
No, we prevailed on testing is what I'm referring to. That was with regard to testing. You never prevail when you have 90,000 people, 100,000 people, when you have 80,000 people as of today.
But experts say the U.S. is still catching up on the testing front. That says coronavirus tonight is striking inside the White House, sending the Trump administration scrambling to control the spread, with at least 2 staffers now testing positive.
Remember how Bill Gates said that, you know, 1 person gets it, then 10 people get it, then 100 people get it, then 300 people get it, however, whatever the numbers were. If this thing was so deadly and 1 person got it in the White House, they all would have it. Especially how close they are and how many times they have these meetings. They'd all have it if it's so deadly. You know, it's like if I catch a cold and I go to work, well, I don't believe that you can spread it that way, so nobody's going to catch it. But I do believe a lot of it has to do with thinking that and saying it in your mind that it's true and believing it. You trick your body into detoxing. I don't know how that works, but there's got to be, you know, we all go through different detox periods, and a lot of us are on the same detox pattern. That's why it looks like there's a mass flu every year, but it's because detox.
President Trump's personal valets and Katie Miller, spokesperson to Vice President Mike Pence. The vice president back at work today after staying away from the White House this weekend. Officials telling NBC News the vice president continues to test negative for the virus and has no restrictions to his schedule. But 3 of the country's top health officials in charge of the federal response are all now in some form of self-quarantine after their potential exposure. Dr. Anthony Fauci, CDC Director Robert Redfield, and FDA Commissioner Stephen Hahn.
Yeah, give me a goddamn break. Give me a break. But I guarantee you they'll magically come back normal and everything's gonna be okay. It's a fucking joke.
It is scary to go to work. I think that I'd be a lot safer if I was sitting at home than I would be going to the West Wing.
The coronavirus scare in the White House, where testing is widely available, undercuts the president's message that the outbreak is fading and highlights the challenges facing businesses nationwide that do not have access to the contact tracing and aggressive repeated testing now in place in the White House. But that could get easier, with the FDA now announcing that it's given emergency authorization for a new type of coronavirus test called an antigen test. Health experts say it's generally cheaper and easier to manufacture than current methods, and the results are faster too. And new tonight, a requirement that anyone entering the West Wing wear a mask or face covering in an effort to help contain the spread of coronavirus. President Trump himself, though, is not expected to follow it. Lester?
Jeff Bennett tonight at the...
He's not expected to follow it, but yet it's so deadly. If it was that deadly, and you could die from it easily, I'm sorry, but he's going to be wearing a mask. Like, why don't you people see this shit? If the threat was so real, why is he choosing not to? You know? Is there some type of plan where he's going to magically catch it and he's going to die from it? You know? Is that what their plan is? Just know that there's always a plan.
White House thanks, and here at the epicenter in New York, hopeful signs as the governor announced plans to partially reopen this week, joining most other states. But in some places, red flags are already emerging. Here's Gabe Gutierrez.
Tonight, for the first time since the pandemic began, parts of New York State are preparing to reopen.
This is the next big step in this historic journey.
Governor Andrew Cuomo says regions can partially reopen on Friday if they meet certain goals, including hospital capacity, testing, and a sustained drop in new cases. Statewide, new COVID hospitalizations are down to what we saw 2 months ago.
From my point of view, we're on the other side of the mountain.
But New York City has not met those goals. Today, a new report from the CDC estimated that nearly 5,300 more people in the city may have died from the coronavirus than the official count. Across the country, 47 other states are also relaxing some restrictions.
If you're going to open up, you darn well better be ready, because the first customers through the door are going to be looking at what you're doing.
In Arizona today, bars are reopening at 25% capacity. This restaurant is using UV light to sanitize its dining area.
We've always believed in protecting the public.
In Indiana,
and I'm just a little sheepy, and I'm going to keep listening to my government because they know what's best for me.
Go back to sleep.
churches are allowing the faithful to worship at a distance.
We had to take out 600 chairs in order to maintain the 6 feet of social distancing.
But hotspots remain in rural Colorado. Morgan County is among the highest infection rates in the state, 3 times as high as Denver. In Georgia, new COVID cases have jumped by 64% since the state partially reopened on April 24th. A new hotspot is emerging in rural Hall County. NBC's Ellison Barber is there.
At least 24 shipping containers are expected to start arriving on this black tarp by tomorrow night. Hospital staff will then help to convert the shipping containers into a temporary medical unit to treat patients with COVID-19.
Still, there are new encouraging signs for America's pastime. Major League Baseball owners are proposing a shorter season starting around the 4th of July in ballparks without fans. As for New York City, it's not clear exactly when businesses here might join other parts of the state in partially reopening. But we've certainly come a long way since late March. Lester?
All right. Gabe Gutierrez tonight. Thank you. And now to the...
Each of us has a purpose. We are destined to do something meaningful. What do you think a private Christian education looks like? GCU offers over 175 high-quality online programs. Find your purpose at Grand Canyon University. Visit gcu.edu.
Those alarming scenes in the sky, images from some crowded flights, passengers wondering what happened to those promises of social distancing on airplanes. Here's Tom Costello.
On more and more planes these days, it's getting busier. Passengers shoulder to shoulder, squeezing past each other, many not wearing masks. On an American Airlines flight from New York to Washington today, at O'Hare Airport in Chicago, on a Spirit Airlines flight to Orlando.
The problem wasn't so bad going, but landing, everybody just got up, and it was just standing, and everybody was just clustered at one point.
This United flight left New York for San Francisco with 25 doctors and nurses who'd been treating COVID patients. But that middle seat not blocked off as United had promised last week. Today, United said blocking is the wrong word. Instead, it's limiting advanced seat selection for adjacent seats in all cabins, including middle seats where available. Regardless of whether that middle seat is blocked, infectious disease experts say a sneeze or cough can travel at least 2 rows forward and backwards.
Okay, so Mr. Experts, explain to me how the fuck at half capacity is going to do anything. Because if that motherfucker sneezes, everybody gets it, right? It's a fucking joke. If you can really sneeze and catch a disease, then everybody on that plane would be sick. Why? Because you're in a fucking time capsule, in a little capsule with no windows. That's why I say it's a bunch of bullshit. And people believe this. Oh, well, if you leave all the middle seats out, everybody will be okay. No. Doesn't make sense. You're able to catch it, like I said, and somebody coughs. You can't open the window and let your cough go out. No, it's gonna continue to fly through the air. It's a fucking joke, man.
How much of a risk is there just on a typical passenger plane these days?
Well, of course there is a risk. This is the kind of circumstance that the coronavirus likes. It likes people close together because it likes to be transmitted that way. That makes it easier for the virus to go from one person to another.
Yeah, if that was real.
Very quickly.
The industry says
very quickly. Then how the hell isn't everybody on there sick? Doctor. Like, I don't believe it for 1 second.
most flights have fewer than 20 passengers. The airline's now calling on the TSA to check passengers' temperatures before they fly. The TSA hasn't yet decided, while Frontier Airlines says it will do that starting June 1st. Anyone with a fever of 100.4 or above will be denied boarding.
And a fever is a serious matter at these times. It may not be coronavirus, but again, it's probably something you want to have checked out.
No, a fever is your body trying to push out toxins. Same with a cold, same with the flu, same with all of it. It's just we get these different, what society calls sicknesses, is because certain parts of our body need to be detoxed. Well, who am I? I don't know nothing, right? I'm not a doctor. I didn't go to the Rockefeller School and get my paper saying that I'm certified. I'm just an idiot who looks on the internet. Yeah.
United says soon it will start advising customers in advance when a plane is 70% full so they can either rebook or get a credit. American promising not to book 50% of their middle seats. Spirit says it will do it when it can. Lester?
Tom Costello, thanks very much. And tonight, new research showing young children and teens may be at greater risk from COVID-19 than was first thought. Our Kristen Dahlgren reports on the new developments that every parent should hear.
Tonight, one of the authors of a new study calls the idea that COVID-19 is sparing young people just false. Researchers looked at 48 children in intensive care. While a majority had pre-existing conditions, almost 1 in 5 did not. The research comes as concern is also growing over the rare new inflammatory illness, believed to be affecting children weeks after a COVID infection. As New York State is investigating 2 more deaths amidst 93 cases. Today, an alert to all parents of New York City school children.
We believe we can reopen schools safely and well in September, but we have to keep a very close watch on this syndrome to make sure that we attack it in every way possible.
NBC News has found cases in at least 11 states. The New York Genome Center is now studying the affected children, trying to determine what put them at risk.
If we knew the genes that are involved, it could really guide how these children are managed.
Symptoms include fever, rash, and upset stomach. Some can go into cardiac arrest. Andrew Lease was a healthy 14-year-old when he suddenly developed a fever and abdominal pain.
Did you know you had the coronavirus?
No. In the hospital, his heart started to fail.
It brought me and my wife to our knees.
Doctors were able to save his life.
We do have strategies to manage the children, and they're uniformly doing very well.
I'm just insanely happy to be here.
Andrew now sharing his story as a warning to others.
Yeah, and most of the time, these people are paid actors.
Kristen Dahlgren, NBC News, New York.
Let's take a turn now to new developments tonight of the shooting death of Ahmaud Arbery, a fourth prosecutor. In 60 seconds, offices, restaurants, and supermarkets. What about out for a jog? A surprising new look at how and where coronavirus spreads.
Want a healthier mouth? Colgate Total. Antibacterial protection for a healthier mouth.
With people heading back to restaurants, salons, and offices, a surprising new look tonight at where the greatest risks may be. With that, here's Stephanie Gusk.
Slowly but surely, the country is opening up.
Doesn't matter if you want it to happen or not, it's happening.
Dr. Aaron Bromwich, an infectious disease expert at UMass, wrote a blog. The risks, know them, avoid them. And it struck a nerve, viewed millions of times. Dr. Bromwich writes, it seems many people are breathing some relief, and I'm not sure why.
What do you think people right now aren't worrying enough about?
Just enclosed spaces and how quickly this can start back off again if we resume what was normal 3 months ago.
Based on how MERS and SARS...
And if he was speaking so much truth, why isn't he being censored? It's because he's paid to. It's like people don't see this shit. I see right through it. I don't know. You ain't fooling me.
Dr. Bromwich says it takes 1,000 virus particles to be infected. A cough or a sneeze can carry 200 million. But he says just being around someone asymptomatic long enough, even if that person is more than 6 feet away, is dangerous as well. Infection equals exposure and time.
The riskiest places to me are, enclosed indoor environments that have poor airflow and lots of people.
Offices.
Oh, so pretty much the whole world, right? All they're doing is setting the narrative so that when shit hits the fan, when they open back up, all they're going to say is, I told you so, I told you so. And then everybody, the masses, are going to beg for help. And that's when it thinks shit's going to hit the fan.
Restaurants and public transportation, he points out, have to be rethought.
We haven't thought about how to engineer a place to keep the air clean enough to be in there when you're dealing with a respiratory pathogen.
But there are places Dr. Bromwich believes we don't have to be as worried about. Like supermarkets, with fewer people being let inside, masks are helping too. And there are very few known
masks aren't helping at all.
Cases of people contracting COVID outside. Runners without masks might get a lot of attention, especially here in New York City, but experts say that the chances of getting the virus from them is likely very low because they move by so quickly, limiting exposure. But
that is the dumbest shit I've ever heard in my life. If you're able to catch something like that, and you're running and you cough, it's in the air. There's no difference if you're running or you're not running. Yet we're so worried about enclosed doors, but then they just magically come over and say, oh my God, worry about being outside too. It's all scare tactics.
Modifying behavior remains key.
This virus doesn't have legs, so it relies on us to move it around. So by taking away its oxygen, its fuel, which is us, you get it under control.
Stephanie Gosk, NBC News, New York.
The White House today recommended testing over 1 million nursing home residents and staff, with a total of at least 26,000 deaths at nursing homes. Cynthia McFadden tonight has an inside look at a solution that...
You also got to remember this. Why are people in nursing homes? It's because usually they're old. Maybe they can't be taken care of. Maybe they're on their deathbed. Who knows? And they're just claiming that 26,000 people died because of this. To me, it seems like they're just literally bringing every death to the forefront to make it look like hundreds of thousands and millions of people are dying when this shit happens every year.
Could save lives.
Connecticut has made a bold move, and we got a first look.
Is this standard operating procedure now?
Absolutely. An all-COVID facility for nursing home residents getting out of the hospital.
Nursing homes were like a petri dish for this pandemic. We've had about 50% of our fatalities have happened there.
That number climbing fast. Connecticut's Governor Ned Lamont thinks forcing nursing homes to take COVID-positive patients, as most states are doing, is a path to disaster.
I'm terrified.
COVID-only facilities.
I'm terrified. Who'd you sell out to? Who's paying your paycheck?
Governor Lamont's solution. This was a 90-bed nursing home until it shut down last November. An ideal setting for a COVID-only facility, says Harvard professor David Grabowski.
Connecticut deserves a lot of credit. They're testing everyone, staff and residents. They're providing personal protective equipment for the staff. And then finally, they're creating these specialized COVID facilities.
Over the weekend, New York's Governor Cuomo reversed his controversial policy forcing nursing homes to take back COVID-positive patients and says they now have COVID-only facilities like this one on standby. Back in Connecticut, the National Guard is lending a hand. Like most of the country, Connecticut has struggled with the shortage of PPE, especially for nursing home workers. Some donning trash bags, they say.
And some are doing TikToks.
To protect themselves. Governor Cuomo has said it is not his responsibility to provide PPE to nursing home facilities.
In a crisis, the buck stops right here. And I can sit around saying, oh, these nursing homes are private enterprises. Why didn't they take care of their own people? Forget it. We're in a crisis.
Here, they tell us they have enough, especially as all the patients will be COVID positive. So, in other words, you suit up in the morning and you're pretty well set for the day.
Correct.
Meanwhile, one union leader tells us 40% of the staff in some facilities are COVID positive or not able to work due to exposure.
You two have volunteered to work in a COVID-only facility. I mean, how did you explain that to your families?
Because I'm sure of my infection control technique, and I've been doing it for a long time.
Yeah.
Wash your hands, wash your hands, wash your hands.
After doing this for over 15 years, I think we're confident
49 years.
in our ability.
Yeah.
49 years of brainwashing, and I'm gonna be okay.
Fucking joke.
Confident, too, that other states could save lives by creating places like this one. Cynthia McFadden, NBC News.
Up next, Richard Engel from Europe, emerging from lockdown. All right, we're back now with more countries starting to reopen and a path many here are closely watching. Here's Richard Engel.
As Europe slowly ends its lockdown, today it was Viva la España in Seville, Spain. Restaurants are now open, but each table washed before customers sit down. Hotels.
Isn't that proper procedure? I mean, when do people not clean the tables?
And bars opening too. In the UK, the government is, for the first time, encouraging people to return to work, but asked them to avoid public transport. Prime Minister Boris Johnson, who got so sick from COVID, official plans were drawn up in case he died, told Parliament today the nation needs to go slow.
Oh, but he magically, he made it through with flying colors. He just so happens to be a part of Parliament, or whatever they said. But, you know, nah, he's good. Got a good immune system. But all these people, these older people are dying. All these poor people are dying. Wonder why.
There could be no greater mistake than to jeopardize everything we've striven to achieve.
In France, today was the grand reopening. Many schools back in session. The metro up and running. It's strange to take the subway again, but we have to get used to it, this man said. Paris's Champs-Élysées looked packed. NBC's Molly Hunter is there.
Shops are back open. Many Parisians are out for a walk or back at work, but experts urge vigilance. 3 new clusters are popping up across the country, one in the suburbs of Paris.
Clusters are breaking out in Germany too, but authorities stuck with their plan to reopen some restaurants and gyms where doors opened to applause. Italy also announced it's speeding up its reopening. Lester, this is all a test to see if we can coexist with this virus without dying economically until there's a cure.
You know what's crazy to me? Is that didn't Italy get devastated, but now they're pushing to open back up? What nobody tells you is that Italy, in certain places, is like really, really dirty. And apparently the air pollution is terrible too. And I can't remember where I seen that at, but that's how a lot of them people get sick. It's because there's an insult to your immune system outside of your body, and it causes you to detox.
Lester?
And that is Nightly News. I'm Lester Holt. Please take care of yourself and each other.
Please go fuck yourself and each other.